Hi, my name's Warwick Bishop and welcome to my website. I'd like to take a moment to talk about a TV program which many of my patients have come and sought questions and answers about. You may or may not have been aware of an ABC program listed with Catalyst in approximately October of 2013. The program was called The Heart of the Matter. In that program, Catalyst raised a number of particular questions. The upshot was that many people who watched that show, which was over 2 nights, took it upon themselves to question the role of statin therapy in their own care. In recent time, in June of this year, a Sydney University group evaluated the impact of that story run with Catalyst, and they found that somewhere around 15,000 Australians made a choice to come off their cholesterol medication based on what they saw on television. The feeling from the research group was that this could in fact impact up to 2,000 people, with the result of them having a cardiovascular event. Obviously, this is detrimental. There are a couple of things to note out of this. First of all, I think it's concerning that individual patients would take it upon themselves to potentially unilaterally alter treatment strategies that have been put in place by their doctor without discussing with their doctor the real risk and benefit for them as an individual and in context of that particular medication for their situation. So first of all, my general feeling would be, if you are ever in a situation where you think a medication may or may not be appropriate for you, and you have had that commenced by a medical therapist or a doctor who's in the right sphere or area, who has the right intent, then the discussion should go back to the person who prescribed that medication to really answer those questions of appropriate use. That aside, however, I'd like to talk briefly about the Catalyst program itself. It came under a lot of scrutiny and criticism, and in fact it has been withdrawn by the ABC following really a barrage of media attention which pointed toward it, leading to patients asking questions about their therapy and potentially making changes unilaterally that were not to their best advantage. The reason why I'd like to speak to that is that I'm not entirely sure that all of the points raised by the Catalyst program should be lost forever based on the response that the public and the media gave that show. I watched that show with an open mind, and in fact am concerned that some of the points that they raised may become taboo because of the backlash that followed the airing of the show in the first instance. If one stands back, as I did, and tries to look objectively at the information presented, I think there were 3 major points that the Catalyst program attempted to cover. I'm not entirely sure they covered them well because the fallout was dramatic. However, putting that aside, if we look at the 3 major points, the first was, is it possible that current eating guidelines that are broadly distributed through the public are really working? And in actual fact, given that we have an obesity crisis here in Australia and also in America, I can't help but think that that is not an unreasonable question to ask. So, the first issue raised by the program was, is it possible our current eating guidelines are not really meeting the needs and expectations that we require as a community? I actually think this is an extremely valuable question to ask, and really it would be to the detriment of a sensible discussion around that area for that information to be lost. The second point that the Catalyst program raised was this: They asked the question, is it possible that there are people who have elevated cholesterols through their whole lives who may not have a heart attack and therefore may not need to be on a cholesterol lowering agent? Well, that seems like a pretty valid and reasonable question to ask. We know that people who have had heart attacks, without a shadow of a doubt, have been shown over and over again in clinical trials to benefit from being on a cholesterol lowering tablet. But we also know of people who seem otherwise fit and well, have elevated cholesterol levels, there may be no family history of heart problems, and these people, without any intervention or without any treatment, seem to live a long life and don't appear to carry the risk of a heart attack or stroke. I don't want to come down on what's right or wrong here, but what I do want to say is it's a very valid question, and certainly from where I sit in a preventative cardiology role, and certainly with an interest in scanning people's hearts, looking for evidence of build-up of cholesterol in the arteries, I find patients who have high cholesterols, who are otherwise well, who have no evidence of build-up of cholesterol in the arteries at all. It's a difficult thing to reconcile, but I think points to the point that we don't fully understand coronary artery disease, and cholesterol of its own is not the only factor. So, the second question that Catalyst asked in this the Heart of the Matter story was, is it possible there are people with elevated cholesterols who may not be at significant increased risk of having a heart attack or stroke, who potentially may not need a cholesterol lowering agent? I think it's a really valuable question to ask, and I think it's a very important conversation to have. I think it's unfortunate that this conversation may never come about again because of the fallout that followed from the program. And now that program has been pulled and is unlikely to be reviewed. The last point that Catalyst made was that big pharma, or the large pharmaceutical industries, potentially have enormous lobbying power. They affect governments, they have impact on free trade agreements, and to a large degree, I think it's important as a community that we know that these huge, powerful multinational companies can have lobbying effect within our community and within our own country. So for the Catalyst program, Matter of the Heart, to raise as a third issue the significance and importance or the potential role that multinational pharmaceutical drug companies have in decision making around prescription of medications in Australia is, in my opinion, a valid and reasonable question to ask. Again, I'm not going to make a comment on whether what the answer about that is, but the discussion around that point, I believe, is something that should be at the front of all of our minds, and certainly is something that, without question, has a big impact on our community, on our political system, and of course our costs of delivering medicine. So, my comments on the Catalyst program, Matter of the Heart, aired October 2013. I have many patients ask me about this, and at the end of the day, 3 major questions were asked. Are our eating guidelines really doing justice for the public? Are there people with elevated cholesterol who may never develop coronary artery disease? And are we aware, as a community, the impact that large multinational drug companies can have in the decision making around the prescription and guidelines of use of medication in this country? I think valid questions, poorly presented, with a significant fallout such that that program won't be aired again, But those questions still require some discussion. Thank you for listening.